Good afternoon, everyone. It's so great to see you again at this webinar. Welcome, 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 everyone. We're glad to have you with us. We're starting now because we are all set. Apologies for starting a few minutes behind schedule. As it's our practice, we want you to kindly just introduce yourself in the chat box, your name and your organization, and so just so we know you. Our speakers are here, our panelists are here, and we're ready for another exciting, educative, interactive session on how to improve vaccine uptake in Nigeria. Welcome again. When it's time for Q&A, for the questions and answer, there is a box, a question and answer box. You can leave your questions there, even as the presentations are ongoing, so you don't forget. Welcome everybody again, and I would start with our opening remarks. I'll start with our opening remarks. Welcome everyone. Yes, we can see you. Please just drop in your name and your organization. Okay, I would like to introduce NSSF again, just not taking it for granted that not everybody here knows about Nigeria Solidarity Support Fund. Nigeria Solidarity Support Fund is a private, non-for-profit organization, and we started in 2020 at the heat of the pandemic. We were created majorly to increase health outcomes, to improve health outcomes in Nigeria. We do this by three main ways. The first way is that we mobilize resources from multiple organizations in order to fund health intervention in Nigeria. Secondly is that we partner with like organizations, with NSSF, to come up to design and to implement programs that will improve health outcomes in Nigeria. And lastly is that we focus on improving these health outcomes by focusing on improving vaccination. So we're very big on vaccination, especially childhood vaccinations. And why are we focused on vaccinations? We know, according to WHO, that 4 million deaths worldwide can be prevented by childhood vaccinations every year. And if we look at it, 4 million deaths every year, by 2030, we would have reduced up to 50 million deaths from just immunizations. So immunizations are very important, and so they are very important to us as NSSF as a way of improving health outcomes in Nigeria. We know that measles vaccines can save almost 19 million lives by 2030, and hepatitis B vaccine can save up to 50 million lives by 2030. So we are focused, and Nigeria is still one of the tier 1 countries, according to WHO, that have this high burden of unvaccinated children or partially vaccinated children. And this is a burden to us as NSSF. And we are taking this initiative and this platform to advocate for ways that we as a country can improve the vaccine uptake in Nigeria. Several factors are responsible for why our vaccine uptakes are suboptimal. Factors such as poor access to health facilities and immunization campaigns, insufficient and inefficient use of resources, limited technical capacity of immunization bodies, and also lack of political will in the country has all led to this. And we know that by talking about this, we can address some of these factors. What is our approach? We know that health systems approach as the best approach to ensuring that primary health care is improved in Nigeria. And we know that vaccine programs are one of the programs that have been successfully implemented across the world. So it's a way to also scale up health system strengthening. Whatever works in the vaccination program, we can scale for other disease areas. And by that, we strengthen health system and in turn contribute to advancing universal health coverage. So as we focus on today's webinar is really focused on management and leadership for vaccination in Nigeria. And the objective for today is to establish the importance of vaccines in promoting good health and nation building, is to discuss the national plan for increasing vaccine access through local production, is to examine the existing data on routine immunization, successes, challenges, and innovations, and to discuss the role of leadership, management, and coordination in improving vaccine programs. And we hope that at the end of today, we would be able to outline the current successes, challenges, and priorities for routine immunization in Nigeria. We would advocate alongside you for effective campaigns, and we would align as key stakeholders and vaccine leaders on collaborative and forward-thinking approach to expanding and scaling access to vaccines in Nigeria. So I encourage you to invite people that you know work in this space that may not have had a link. So help us to spread the word, invite people, your colleagues that you work with to join these webinars. We hope that it will be very, very important and effective in aligning to improve vaccine coverage in Nigeria. So at this point, I will hand over to our moderator for today. Shola Ogudigbe will be taking the session and moderating the webinar today. Over to you, Shola.
Yes. Yes, thank you, Dr. Fijiro. Thank you for the introduction. I wish to welcome everybody to this webinar. And like Dr. Fijiro has told us, we have a presentation that speaks to the issue. And the presenter today is, the presentation for today is going to be by Dr. Kikelomo Lampo. And she's going to be speaking on strategies for improving management and coordination of immunization programs in Nigeria. I think we have the representative in the house.
We're going to go to the opening address.
Actually.
We're going to go to the opening address by MPHC today.
We have the representative for the speaker in the house.
Apologies, everyone. It seems that we may be having some technical difficulties with our moderator this afternoon. So I'll be helping him to co-host with the issues. So for now, we're going to go with the opening address. It's going to be delivered by Tajoke Kolawole from the National Primary Healthcare Development Agency. So over to you.
Good afternoon, everybody, and thank you for having me on this platform. I want to appreciate the NSSF for organizing this webinar series and getting people to talk about these issues, especially about immunization and strengthening immunization in Nigeria. I'm actually representing Dr. Basi, who's the Director of Disease Control and Immunization who is unavoidably absent. Just to say that leadership usually it goes along with governance when we are speaking in terms of immunization, is one of the important pillars in the immunization sector and is essential for the success of the immunization program. And leadership promotes ownership, it promotes accountability, it promotes sustainability in the immunization space. The routine immunization program in Nigeria is actually quite robust and is one of the strong programs in the primary healthcare system, and is the basis on which other interventions are now being leveraged, especially in the PhD sector. And the program is also being leveraged by other sectors like the vital registration and civic registration sector, where we are using it to improve birth registrations across the country also, because these are well-established systems. PhDs are in communities close to us, and people bring their children for immunization, and then they get registered. So also one of the goals when NERIC was established, and NERIC is National Emergency Center for Routine Immunization, the National Emergency Routine Immunization Coordination Center, and it was established in 2017. And part of its goals was to strengthen leadership, coordination, and accountability. And that is all contained in a document, which is the NSSF document. It's a platform which we use to improve routinization across the country, and where all stakeholders can gather, and that is where the leadership and coordination of routinization generally takes place, and it has evolved also to the states and to the local governments, also having routinization focal persons at the ward level. However, as with all programs and with all challenges and in all spaces, we have challenges, and this affects effective leadership and coordination. And some of them include poor understanding of the immunization space. Not everybody understands what immunization really is all about. Even medical doctors at times, it can be a challenge for them to understand really what immunization is. Political interference also contributes to poor understanding, because we put non-technical people in spaces that should be held by technical persons, and then all this affects quality, and then also poor capacity in some areas. But generally, the NPHCDA is committed to strengthening leadership and coordination, especially in the routinization, and as a fulcrum to strengthen PHC services and access to PHC services. And we continue to do that through continued engagement of leadership, all the state leaderships, especially the state primary healthcare boards and our state immunization officers, trainings, and development of policies together to strengthen all these processes. So once again, I'd like to welcome everybody to this webinar. I trust that at the end, we will have a better understanding of how we can better improve together as a country and as a team, improve leadership and coordination structures to help us to be able to improve our routinization indices. So we are not where we want to be yet, but this is an avenue for us to improve those indices when we strengthen leadership, when we understand what it entails, and when we strengthen accountability to be able to improve our routinization coverage. Thank you very much.
Thank you so much for that opening address, Dr. Adejoke. We appreciate your efforts this afternoon, and we also appreciate the efforts of the NPHCDA as being one of the leading stakeholders in the management of routine immunization programs in Nigeria, and your efforts in strengthening leadership in this area. So thank you, and thank you for representing Dr. Bassi at this time. I'm mindful that our moderator hasn't returned back to the event. So for now, I'll be moderating this event. My name is Lola Makonjola, and I work in Nigeria Solidarity Support Fund. We want to encourage everyone, as you've joined today, to please continue to use the chat room to introduce yourselves. But also don't forget that as we go along in this program, there is a Q&A box. And we encourage you to use this box to ask questions, to pose questions to our speaker, our panelist members, and feel free to ask questions that you may have in your mind that you feel like you want answered today. This is an opportunity for us to learn and grow together. So once again, we thank you all for attending. Those of you watching us on Facebook, we thank you. Those of you watching us on Zoom, we appreciate your time and effort this afternoon. And yes, good day to everyone joining. So we're going to go on to our first and keynote address for this conference, and that will be delivered to us today by Clinton Health Access Initiative. We were supposed to have a representative today in terms of Kikeloma Lambo, but unfortunately she has not been able to join us today, but she has sent a representative in her place to give a robust presentation on strategies for improving management and coordination of immunization programs in Nigeria. Please can we all welcome Ms. Sima Unogu to give her keynote address.
Good afternoon, everyone, and thank you, Dr. Adejoke, for the opening remark. I'm Sima Onogo from the Clinton Health Access Initiative, and I will be presenting on strategies to improve management and coordination within the immunization space in Nigeria. I just have a few slides that I'll be presenting, and I hope you can see my screen. We'll put this document together looking at the WHO's recommendation for improving management and coordination within the program in Nigeria, as well as the experience that we've had working in the immunization space in the country. Just for context, just to give the importance of what immunization is a core function of health system, and it's central to achieving our universal health coverage. And our key pillars, include equity in immunization across life course, and local solutions to local challenges. And we want to be in a world where we see that everyone, everywhere, and at every age, has full benefits from vaccines for good health and well-being. This is what we see when we're looking at immunization, and then we cannot undermine how important immunization is to the public health space. And then to look at public health in general, we know that it has complex problems that needs complex solution. So we don't just have one stakeholder that plays within the public health space. If you ask a layman, I think if you ask them one ministry or a ministry that is involved in public health, most likely all you hear will be the Ministry of Health. But there are different stakeholders that play different roles within our public health space. We have different factors that are actually situated outside our sphere of influence within the public health space. And this means that there are other sectors that actually have resources that we rely on to actually achieve our immunization goals. I will give an example because I work within the vaccine finance space. Just looking at vaccine financing as a pillar within the immunization space, you would see that there are different stakeholders that play different roles that would see, for example, that Nigeria fulfills its commitment to procuring vaccines and devices in the country. So we see that as a crucial part. Crucial part for this complex solution is needed to involve all the actors, and not just the core public health actors outside the public health space, to see that our public health challenges are effectively addressed. So we have looked at policy integration and coordination. And looking at integration, we're seeing that it's just integration of the content. So your goals, your instruments of policies of several sectors. And for coordination, literally is just the process to realize integration, processes of planning and making decisions. So basically, we're saying that for a system to function well, that all parts must be balanced, connected, and coordinated. So at the extreme right, you see key pillars that play key roles within the immunization space. You have leadership and governance, and Dr. Adejoke mentioned this during her introductory speech. We also have the health workforce. We have finance, like I mentioned, a space where we're working. There is medical product and technology. There is service delivery. There is information, surveillance, and reporting. And we have, demand generation and communication, which plays a role within the community. But then again, you see this 8 or more different pillars. There needs to be some sort of coordination for them to come together for us to achieve our public health goals. So there needs to be a common vision that is shared across stakeholders within these 8 pillars. And aside from that, there needs to be a formal coordination mechanism where we implement and agree on objectives and then manage division of tasks and responsibilities. For example, when I look at vaccine financing, giving it as an instance, we have the Vaccine Financing Accountability Task Team that was set up as a coordination platform where we have different stakeholders who meet monthly to discuss vaccine financing challenges that the country is facing. And you have stakeholders beyond just your core finance or health finance roles. You have people who are in the program area within the immunization space. We have people, staff from the MPCD on the program side, staff from the MPCD on the finance side. We have stakeholders from the World Bank, from WHO, BMGF, Gavi, and donors, and other donors that play key roles in the immunization space. Just to tell you how we have different players that play different roles, and not just looking at the primary, the core public health stakeholders within the immunization space. And looking at the next point, we see that we need to involve a wider group of stakeholders. This is critical. Looking at just stakeholders outside the immediate public health space, thinking of who would play a vital role, whether vital or non-vital, but to see that these stakeholders are identified and they are coordinated in such a way that we achieve our goals. For example, if someone will tell you that the Central Bank of Nigeria or the Office of the Accountant General of the Federation is a stakeholder within the immunization space, it might sound off to you, but these are stakeholders that play key roles within the vaccine financing space and therefore are stakeholders within the immunization space in Nigeria. And there is need for both vertical and horizontal form of coordination among the different stakeholders that we have identified, both government and non-governmental in different sectors. So what can we do? What can we do? What can we consider to strengthen, management and coordination within the immunization space in Nigeria? We need to consult and involve our leaders. Not just the core leaders in the Ministry of Health. Even up to the presidency, the parliament, people that are involved in policy making. We have people within the Ministry of Finance, like I mentioned, and then civil societies and private sectors, and even academic representatives for research purposes. And then we need to have some sort of political commitment to the immunization goal, the public health goal that we have in the country by our leaders that have been elected by us. Their engagement is not only essential for resource mobilization, but also for enactment of law, regulation to ensure that we have some sort of sustainable public health finances and public health space in the country. And then for academic institution, like I said, research is something that we cannot take for granted. These are institutions that need to be engaged to see that our research and evaluation component within the program is actually strengthened. And the role of civil society, of course, cannot be undermined. We need people that will give voice to non-state actors, those that are socially and economically disadvantaged. In addition to the civil society playing a role for increasing advocacy within the community. And also this has to do with, vaccine acceptance. When we look at the roles that the civil society will play in actually pushing up the uptake of vaccines within the country. And then there's also, like I said, the private space, the engagement of private medical and supply chain and equipment maintenance sector. Supply chain is another key component of the immunization space, and we need to actually engage stakeholders within this space. And definitely we have provincial and regional state management immunization plans. We should see that they follow process and structure and that they are linked to the direct health plans that we have. Also, there should be some sort of documentation of risk and how unreached communities are actually identified. This is just to prioritize activities and see that our stakeholder engagement is done and we reach every community. So basically, this is what we have so far. And then just to highlight that, in summary, that every stakeholder in the immunization space plays a very vital role. Across these 8 pillars, there are stakeholders that need to be identified, not just the popular ones that we know, but stakeholders that are outside, the well-known stakeholder mapping that we've done, and engage them to see that we have, a very robust and healthy immunization program in Nigeria. Thank you.
Thank you, Sima, for your presentation. That was awesome. That was very robust, and I'm sure that people have questions, which is why I'm going to encourage all our attendees to please use the Q&A chat, to use the chat room to share questions that you may have. In particular, I have questions which I'm going to throw to our moderator of the panelist discussion session to throw your way. So stay on board for the questions that I have too. So before we move ahead, thank you once again. I know that we can't all physically clap, but if you can give her a virtual clap for that presentation, we really appreciate you for coming and giving that. I've just had a question, will there be a Q&A at the end of the presentation? Well, please feel free to use the Q&A chat room to write your questions, and they will be answered in the next session that we are going into. So we're going into our panelist discussion session. And here I'm going to introduce some of the people that we have in our panel, and I'm going to kindly ask that our panelists put their cameras on. So you have met Ajoke, thank you so much for your opening address. You have met Sima. I'm going to introduce you now to our following panelist members, before we go into the session that will be moderated by Dr. Ameze Egwavoyin, who is the Programs Manager for NSSF. So Dr. Elijah Ogutola, who is on our screen. Dr. Elijah is currently the lead of the primary healthcare response in the state, as the Executive Secretary of the State Primary Healthcare Development Board, with over 2,500 healthcare workers working with him. Under his leadership, Ogun State interrupted the transmission of vaccine-derived poliovirus within 3 months of this discovery in 2019 through coordinated outbreak responses, and has not reported any other case of circulating vaccine-derived poliovirus since the last case in 2019. He also led the introduction of COVID-19 vaccine into the state immunization schedule in March 2021, and won the best performing state in COVID vaccination in the Southwest, an award presented to the representative of the governor in August 2022. He's a graduate of medicine and surgery from the prestigious University of Ibadan, Oyo State, Nigeria, 22 years ago, and he has a master's in public health from the Olabisi Onabanjo University. His vision is to promote a robust public health response in Africa through peer learning and reviews among public health leaders in Africa. Please help me to welcome Dr. Elijah again to our panelist discussion. Our next panelist speaker is Dr. Olayinka Stephen Ilesomi. And Dr. Olayinka is a community health physician trained in health management, epidemiology, public health, and community medicine. He completed his residency training at the Department of Community Medicine of the University College Hospital in Ibadan, Nigeria, where he also engaged in and oversaw research projects on health economics, infectious disease epidemiology, and the prevention and management of communicable and non-communicable diseases. In the 2014 Ebola outbreak, he was employed as a medical epidemiologist with the African Union's support to Ebola outbreak in West Africa. For his remarkable contributions to the Ebola virus disease response in 2015, His Excellency, Dr. Ernest Bai Koroma, the Executive President of the Republic of Sierra Leone, presented him with a service award. He's particularly interested in global health, infectious diseases, communicable and non-communicable diseases, and tobacco control. In 2020, he was the Best Researcher of the Year and awarded by the Medical and Dental Consultants Association of Nigeria, UCH Ibadan chapter. On Google Scholar, he is among the researchers with the highest citations in Nigeria. He is the current program lead at the West African Coordination Center of Africa, CDC, Abuja, Nigeria. Please, alongside him, help me to welcome again back Dr. Ajoke and Sima to our panelist discussion session. And now I'm going to hand over to Dr. Ameze Egwavoyin, the Programs Manager of NSSF, to lead us in this discussion session.
Thank you very much, Lola, and good afternoon, everyone. Thank you to all our participants for taking the time to join our conversation, and to our distinguished panelists. Listening to all the bios being read, I'm like, okay, we definitely have the right people in the room. And I'm looking forward to having a very robust and insightful conversation. So thank you once again, and I will jump right into it. And I think that I will start with Dr. Sima, since you just gave the presentation. And I would like to ask your experience in Chai. Are there any strategies or best practices that you can share, especially from other countries, that have helped to improve management of immunization programs and can be adopted for use in Nigeria?
Thank you, Oyinola. Just like I presented, I think the first thing is to actually identify stakeholders. Just do your stakeholder mapping. Understand stakeholders that have high interest. Understand stakeholders that are influential and stakeholders that are not too influential but also have high interest. When you do that stakeholder mapping and then you actually have some sort of identification of every stakeholder that plays an important role within the space. There is also the factor of coordination, setting up meetings where you have platforms where you have the stakeholders come together, on a timely basis, monthly, quarterly, or weekly, where they discuss immunization challenges. Getting to hear from different people in the room within different sectors in the public health space is also critical. We see people that come with their different opinions that would actually enrich the challenges that we are trying to solve. And then also, definitely what we have again is constant follow-up from the meetings that you have from these coordination platforms that we have set up, always keeping them engaged, having some sort of, if it is a bulletin that you share on what is happening within your space, ensuring that the stakeholders are actually up to date with what is happening within that immunization space. And these are strategies that we have put in Chai and also seen work, in other countries that help to strengthen management and coordination platforms in immunization space.
Great, thank you. Thank you for putting that together so succinctly. So, you have definitely highlighted the importance of coordination and having a platform and then communication. And then, I see a hand up. We will come to questions from the participants. But in the meantime, you can also use the Q&A box. But yes, we will have the opportunity to speak and ask your questions directly. But if you can start with the Q&A box, that would be great. So I was just saying thank you to Dr. Sima for putting that so succinctly and for highlighting the importance of coordination and two-way communication so that we're clear that everyone is on the same page. I would like to go to Dr. Ilesomi from Africa CDC. And I would like to ask, what role does Africa CDC play in supporting the management and coordination of routine immunization innovations in Africa? How have you been able to drive innovations in Africa? And are there any innovations that you think should be scaled up?
Yeah, thank you, Amaze. And thank you for previous speakers. I believe you can hear me. So at Africa CDC, we believe that in driving innovation for vaccination in Africa, to start with, there is a need to upscale vaccine production. At the moment in Africa, the production of vaccine on the continent is just about 1%. And it is being done in countries like Morocco, Tunisia, South Africa, I think, and Egypt, and Senegal. So they are the countries. So now what we are thinking of doing in Africa CDC is that by the year 2040, we want the production of vaccine on the continent to be upscaled to about, I think, 60%, so that 60% of the vaccine that we are using, we can upscale it. Now, there are a lot of partnership engagements for that. Just like when we started COVID-19 vaccination, we're able to get in a lot of partners to join us, like the Bill and Melinda Gates Foundation. Also, the World Bank was there to join, and also Africa Development Bank and several other partners, they supported. So now we are also trying to get their involvement in ensuring that we have more financial support to help boost immunization vaccine production rather in Africa. Apart from this, just like one of the previous speakers stressed the importance of research. So as part of the fund that we got recently, the Institute of Infectious Disease in Makerere University were given some grants by Africa CDC to help us do a lot of research work in ensuring that some of the bottlenecks, some of the issues that we have, they are well understood. And by the time these are well understood, we'll be able to overcome many of the challenges. Just like we said earlier, that the issue of vaccination, it's very complex and it also demands complex solution. So research is part of what we are investing in it, and also advocating for more resources. And once these two things are there, I'm sure that most of the problems that we are facing will be solved. And we're also trying to upscale some innovations. Like recently in some countries, drones are being utilized in vaccine distribution. So some of these innovations have been carried out in a few countries in Africa, like in Rwanda, they have done that, in Ghana and some other few places. So we are trying to learn more from countries that have been able to do this, and also ensure that more countries are adapting innovation in spreading vaccines and getting things done better than before. Thank you.
Thank you so much. That was very well said. And if you can see Dr. Fejiro, her camera is not on, but my GM, Dr. Fejiro, is a strong advocate for local vaccine production. So I'm sure she was really excited to hear you touch on that and R&D. So I think that will take me to Dr. Adejoke, who's representing MPHCDA. And I'd like to ask seeing that Gavi is, pulling out support for in-country support by 2028, how prepared is Nigeria to fund, production and supply of vaccines and the entire immunization program? What role, how are we making sure that we are positioned to sustainably raise immunization, access to vaccines and immunization coverage in country? Thank you.
Thank you very much, Dr. Amazing, for that. So MPHCDA, since we graduated to middle-income countries, I've had to that's when we talked about crafting the NSSF plan, which is the Nigerian Strategy for Immunization and Primary Healthcare System Strengthening. And in it was where the structure of how we're going to graduate from Gavi support into sustainable financing for vaccines was captured. And also as part of it is, and especially with the experience of what happened with COVID-19, where we had to be waiting on other countries to give us vaccines, was what prompted us and with the Federal Ministry of Health and all our stakeholders to develop the National Vaccine Policy that has been signed, and it's already we're already kickstarting, already working on the coordination platforms that are already there for local vaccine production. It also includes for resource mobilization, for cold chain and supply chain management across the entire country. And all this is an effort to ensure that vaccines get to the community and into the arms of the eligible persons in a potent form and in potent state, and at a minimal cost to the end user. So we have been working on that with resource mobilization, like when Sima was presenting, and she talked about the vaccine financing task force. Those are part of those structures that are already in place, and mostly for resource mobilization to ensure that there are funds for the country to continue getting vaccines, continue procuring vaccines until we start our own local production. But even currently, as at now, we actually the traditional vaccines are actually procured by the government of Nigeria. We just get support for new vaccines from Gavi, and we appreciate all the other partners and to other governments also that also contribute to ensure that we get vaccines to our children. But those plans are in place and they're already working, and those resources and structures are already there for us to graduate and be able to get the number of the vaccines we need for our children and other persons. Thank you.
Great, thank you. Thank you very much for that response. Just a reminder to everyone, please feel free to use the Q&A. To our panelists, feel free to respond to some questions as they come in, or we'll take some of them. And in fact, I think we'll take one now. And I think I would pose it to Dr. Elijah. So there's a question that asks, what has consistently been the biggest challenge with immunization and how has that been managed? I think you can talk about it from a local context in your state. What has been your biggest challenge? How has it been managed? How can we do better?
All right, thank you very much. I think you can hear me, Dr. Amaze. All right, let me join the other panelists. Let me thank the keynote speaker from CHI. Well done. That was a brilliant presentation. And let me congratulate NSSF for this webinar. NSSF has left a footprint in Ogun State, and let me put the, can you hear me? I hope I'm audible.
You are audible, but we lost you for a bit, like your network went off.
Okay, so let me put it on record that the COVID-19 prize that we got was actually facilitated by NSSF, coming to support us during the introduction of COVID-19 into routine immunization. So thank you very much, Dr. Fejiro and team. As I said, from the question, there are so many challenges plaguing immunization services across the state. For us in Ogun State, immunization can be divided into two. We have the service provision side and the demand side. From the demand side, there are a lot of problems. We have a lot of our mothers starting very early, starting very well with their BCG, the first immunization, OPV 0, but along the line, they are lost in between. So we have a lot of dropouts coming in between for our vaccination. And one of the things we have been able to assist to this is increasing urbanization. When we started originally, the majority of our settlements are clustered around the facility. But now there is a lot of pressure. A lot of people are moving from Lagos to Ogun State because of the expense in Lagos State. So Ogun State seems cheaper. So a lot of new settlements are coming in, and the health system is not able to respond to the rate at which urbanization is going. So if you see a health facility, the distance between the settlement to the facility are well over 10 kilometers. Even our outreaches cannot reach them. So majority of the time, a lot of our clients are lost outside the radius of their facility. This is impacting negatively on our health. So at the demand side, because their settlements are far, it's very difficult for us to reach them. Also on the supply side, because of the fast and increasing rate of urbanization, settlements springing every time, it's also very difficult for the health system to cope in terms of human resources. So in terms of human resources, it's actually pretty difficult. And the issue of human resource for it is not only in Nigeria. I just got a news that even in the US, the health workers are going on 3-day strike. So it's a global problem, but it's one of the things affecting, our immunization service delivery in Ogun State. What should have also been, what's also causing problem is the myth and misconception about vaccination. Of recent, we're meant to introduce in September 25th HPV, which is meant to be for girls 9 years for routine nation schedule, but 9 to 14 for the campaign. But you could see what is trending. And that myth and misconception is a major problem affecting routine immunization affecting campaign. You know, there are some tribes that, you know, we have a mix between Republic of Benin and Nigeria. There are some tribes that they are in their culture, they don't take vaccination. And every 2 years, they come down with measles outbreaks in their community. So myth and misconception, increasing rate of urbanization, that of human resource for health to cope with the increasing rate of urbanization are some of the challenges presently affecting immunization services in Ogun State. Thank you very much.
Thank you, staff, for elaborating on that so well. But I think I'd like to stay with you a little bit because there's actually a question that you kind of touched on. It says, it appears our healthcare providers are not often on top of breaking issues to be able to give timely responses to people's concerns at PHCs. How do we make the difference in the forthcoming HPV mass vaccination campaign? I think the crux of the question is, how are we going to make sure the HPV vaccination campaign is successful? Again, you touched on myths, you touched on all the challenges. So what are we going to do differently to make sure that this campaign is successful?
All right, thank you very much. Actually, we were not perturbed, and let me also put on record the leadership of Dr. Faisal Shoaib. National has done a lot of demand creation on HPV with the team and Dr. Bassi, and I'm sure Dr. Adejoke is representing Dr. Bassi. So a lot has been done. I had some conversation with Dr. Bassi, and if all of us can recall, 30 years ago when OPV came, there were myths, and they were saying that people that take OPV, they want to sterilize the children. And 30 years after, the population of Nigeria, we can not even control it. So I wonder what happened that myth, what they said wanted to happen with OPV was, didn't eventually happen. So we as a state have started tackling this. The Honorable Commissioner for Health has gone on here, and we have been here. And she was able to give personal testimony of her daughter that took this HPV vaccination at the age of 12. She's a doctor now in the UK, and you know what I mean. And none of the things they said in that video clip happened to the lady. So we have been able to, play that one consistently. We also have the leadership of Her Excellency, the wife of Governor. She has a jingle, already on HPV. She has a jingle already on HPV that is being heard in our radio across all the local government, trying to tell them that human papillomavirus vaccine is safe and they can take. We stayed a bit. We were doing our mobilization on the ground, but for the next 2 weeks, we've already done a strategy. On Monday, we are going to have a media rally with all the press officers so that we want to tell them our own side of the story. And on Tuesday, we are meeting with our technical working group, and we've already identified radio stations across the 3 senatorial districts of the state, and we're going to take the airwaves for the next 2 weeks, trying to tell the people about our own side of the story. And we know it might be a bit tricky. We just finished our NIPDs, and it really affected our NIPDs. In fact, the number of non-compliant we got is actually the highest in the past 5 years because of the video recording. But we're able to solve all our non-compliances. So we're also very, very hopeful that with this HPV vaccination, there might be non-compliances, but we're going to ensure we solve them. Lastly, we're going to, we normally use our traditional and our religious leader. We've already have interface with them, and we're going to also go through them to ensure that they help us demystify all these myths and misconceptions. Lastly, we're working with the Association of Parent Teachers Association in the state and Association of Private School Owners to ensure that we pass the message, because majority of our target population are in school, and we are working with those groups to ensure that we give them the right information. We already have the approval from the Ministry of Education to reach out to those schools. So with all these strategies I've been able to highlight, I'm sure there might be challenges, but we are going to mitigate it and we're going to have our coverage. Thank you very much.
Thank you so much. That sounds like there's a very robust plan that's in place. I hope that's when it comes to when the boots hit the ground, that we will be able to implement all of them and achieve the results that are expected through all these strategies. Well done to you and the team and to the whole of NPHCDA, because obviously the national team has been coordinating this, so well done. And I hope that response addresses your question, Yinka Shukumbi. I would like to go to Chai. There was a question that says from Muknan David Nche. Thank you, Chai. How do you suggest that faith-based organizations can be engaged and leveraged for coordination and immunization financing? And I come to Chai because I know, well, financing is something you do. And anyway, the question is specific, directly directed at Chai. So please respond to this. How do you suggest faith-based organizations can be engaged and leveraged for coordination and immunization financing?
Thank you. I think the faith-based organization, I think that is one stakeholder that, we had mapped during our stakeholder mapping analysis. Well, we didn't map them as, somewhat influential. But then again, looking at what they can do in the space of immunization financing, there is, some sort of social components that they can probably play when we look at immunization financing, especially in light of where we see ourselves transitioning out of Gavi's support in 2028, like you said. It might not be material as other stakeholders like the AOGF or the CBN, but still, just even lending out a voice on how important it is for the government to actually fund immunization activities from their own sphere, lending that ear or that sort of support to the role that the government is playing with providing vaccines and antigens for these kids to see that they actually immunize against preventable disease can come a long way. It might not have, that high or that much of an impact, but still there are those little drops of water that, when you put them together will form an ocean. So, lending their voice in what the importance of immunization, and then how immunization will see that kids are actually vaccinated against vaccine preventable diseases, and just putting their voice out there, I believe would play an important role.
Thank you very much. I think I will come back to, there was a question. I'm sorry, I've lost the question. Okay, so Dr. Olisami actually touched on vaccine production. So I'll just ask one of the questions here that speaks to, someone said, Vivian Ajiga, I think first of all, there's a lot to be done to make Africans believe in our locally produced vaccine, that foreign is better perception. That foreign is better perception must be addressed to increase acceptance. Okay, it's not much of a, I think it's more of a statement. But if you want to comment on that, feel free, because we know that vaccine hesitancy is an issue. Part of it, even with COVID, was the distrust in vaccines. And we know that Africans and Nigerians in particular, there's some distrust in whatever is locally produced. So how are we going to address this potential challenge and vaccine hesitancy in general? So I think you can just touch on that briefly. Thank you.
Yeah, thank you once again, Dr. Amenzi. I think to address that, there is a need for us to involve wide variety of stakeholders. I think one of the panelists mentioned that earlier, that we need to involve a lot of stakeholders to overcome the problem of vaccine hesitancy, to prevent hesitancy, and also to get the support of people that are meant to take these vaccines. Now, if we continue the same way that we have been doing our advocacy, I'm sure that hesitancy will still stay there with us. So we need to also bring in more innovative ways in ensuring that more stakeholders are involved. Some of these stakeholders involved include religious leaders, even the old men and women in the community, the opinion people that people can trust, they can respect. By the time we involve all this, and also the communication specialists, the journalists, those in the media and print, they also have to be involved. They are very important stakeholders so that they can communicate with people, their audience through the various platforms, and let them know the importance of this vaccination, and also to know, and also to do like try to counter all the negative information and try to give people the kind of information that they need to understand. You know, about COVID-19, a group of people, by now, I think they're expecting all the people that were vaccinated to have died. And up till now, we are all living, we are fine. So to show that people just spread evil and maybe bad news, which spread faster, kind of. When you spread something that is not right, that is a way, it goes around very fast. So we also have to be proactive. So that's what we need to do. Thank you.
Great, thank you very much. I trust that addresses that for me. I'll take one more question I'll direct one more question to MPHCDA, then I'll take a few questions. If any participant wants to ask any questions live, it might take 2 or 3 from participants. But this is to MPHCDA. Someone asked, here Buhari, with Nigeria's remarkable increase in immunization coverage from 33% in December 2016 to 54% in March 2019, attributed to the NERIC-SERIC framework and the ambitious IA 2030 goals, where Nigeria aims to achieve a minimum of 84% coverage by 2028. What strategic approaches, valuable lessons, and cross-sectional partnerships should be emphasized to not only sustain this progress, but also ensure equitable access to immunization services for all? So this is from eHealth Africa. So I think I would just start by echoing there's a subtle accolade in there that there was some increase in immunization coverage. So well done to MPHCDA, the NERIC and SERIC team in spearheading this progress. But how are we going to ensure that we sustain this? And then I'm going to add something onto that. How are we building the capacity of the team members at the state, subnational level to ensure that leadership and coordination happens not only at the federal level, but also at the state down to the local government level, so that we can actually sustain this progress? Thank you.
Okay, thank you again very much for those questions. So first and foremost, we didn't do it alone. Like you will see, we have a multitude of stakeholders that we all came together, even in crafting the strategic plan for rolling out these measures to be able to get to the vaccination coverage we had. The states were very key, the local governments, even down to the ward levels at the health facility, everybody was key to getting this done. And to continue sustaining it is why the partnership, why NERIC was brought about because of an emergency, but because it has been a structure that has been strong and has helped us to achieve this. It's the structure that we are still maintaining, and across all the levels, to continue strengthening immunization practices and to be able to reach our goal by 2028. Yes, we had some setback with COVID-19 and all that, but it's still one of those strong platforms that we have to continue this strategy and to be able to reach people. So we have the optimized integrated sessions. We have also improved optimized outreach sessions to be able to get vaccines to the community, so that nobody has to walk more than 1 kilometer to be able to get vaccines in their arms. Also, like said, apart from the states, we have been working with our traditional and religious leaders to continue to propagate the messages for immunization. So we have the Traditional Leaders Council, we have the Northern Traditional Leaders Council, then we have the Southern Traditional. Our traditional institutions are also very key in helping us to be able to push this agenda forward, helping us to address rumors, helping us to address hesitancy. They are also key, even when we have campaigns, when we have for supervision, they are key, especially the traditional institutions for contact tracing in their communities, for children who have missed immunizations, for them to follow up. So they are very, very much involved, and we're expanding the scope across the country. So initially we had only the Northern Traditional Leaders Council, which was brought about by polio, and because it had worked so well for us to be able to eradicate the wild polio virus, we had expanded it, and we used the COVID-19 platform at that point to be able to expand it to the southern states, and it's also what is helping us to be able to reach people in those communities. So we have one of those structures that are also still working at. There's an immunization task force in all the states. It's where all stakeholders also come together. So NERIC is the platform they use, but there's an immunization task force, which usually is chaired by either the governor or the deputy governor. For them, the secretary as the executive secretary of the Primary Health Care Board. So that there's ownership and there's that leadership for them to be able to take it on, to be able to know what the issues are and to be able to address them at those high-level technical levels that will be able to now translate down to the local government and to the boards. For building capacity, I think we regularly, apart from, we also use this NERIC platform and immunization task force also when we have to develop, when we have to strengthen policies or develop policies to get the buy-in of stakeholders at the state and all the levels, to be able to use that to train and also to disseminate messages. We have regular meetings with our stakeholders, that the executive secretaries, we have quarterly meetings. And then when we have, like now that we're introducing the HPV vaccine, we also bring them in, they're also trained. And then all that is to improve knowledge around immunization, what to do. And the training is not just about giving the jab, it's also about training on communication and advocacy, on coaching, management, all the pillars that aim to strengthen the routine immunization system as a whole. So all these are available. Then the NPC also has the technical support unit program, which when states say they have a need for training, especially for technical training, depending on what it is that they wish to be trained on. We have that unit already crafted and set up that supports the states technically to be able to improve management and knowledge on immunization issues and across the PHC space in general. So those structures are there. And then regularly, when we also have resources for other trainings, we also bring it and we also disseminate to the states, the zonal level, for them to be able to improve their knowledge and also strengthen the immunization system. Thank you.
Thank you very much, Dr. Adejoke, for that. I don't see any hands up. I said we could take a few questions from the floor, but I would go on with the next question from the Q&A box since there's no hand up. Abdul Mumani Samuel Aliyu. Okay, I see. Okay, now the hands are coming up. I'm going to take this one first. He says there has been several rounds of RI intensification across states, and Chai, I think I'll direct this to you based on your experience, your program experience across the country. Please address this question as best as you can. There has been several rounds of RI intensification across states. If this was done effectively, coverage for VPDs, vaccine preventable diseases, should improve, and more people are expected to be protected with great impact on herd immunity. Unfortunately, we still have outbreaks of diphtheria in majority of states where these rounds of intensification activity was done. What are we not doing well? What could be the reason for these recent outbreaks despite several rounds of intensification? Okay, So Dr. Sima, over to you. And please, for the other panelists, if you want to weigh in on anything someone else has said or a question that's been asked, please feel free to indicate and we'll call on you. Thank you. Dr. Sima, I see your mic is off, but I can't hear you if you're speaking. Okay, maybe I would go to Dr. Lesami if we can't hear Sima. Dr. Lesami, would you like to take that question, please?
Sorry, I didn't hear the question clearly. My internet
Okay.
went down, but I'm back now.
Okay, so it's basically saying that several rounds of RI intensification has been happening across states in Nigeria. And if it was done effectively, coverage of vaccine preventable diseases should improve, coverage of vaccination against this. And more people are expected to be protected with great impact on herd immunity. Unfortunately, we still have outbreaks of diphtheria in majority of states where these rounds of intensification activity was done. What are we not doing well? What could be the reason for these recent outbreaks, despite several rounds of intensification?
Okay, thank you for the question. I believe that there are still some people who have not been vaccinated at all when it comes to diphtheria vaccines. So a lot of things has to be done. We still have some areas where we have security challenges, and they are called the so-called hard to reach areas. They are there. So we need to intensify our efforts, get more people, just like Dr. Adijoke said earlier, involving the traditional rulers, involving the religious leaders, and so on. We need to do more of this. We need to get it down to the grassroots. So until this is done, I'm sure that we are still going to be having a form of outbreak here and there. So there is a need to do more. And I don't believe that we are doing, what we are doing is enough at the moment, even though we are better from where we started from. So when you're assessing yourself in terms of success that you have made, it's good to make comparison from where you are starting from. But I think we still have a lot to do. More capacity building still needed. Even the healthcare workers, are they enough to go around over the few days of the immunization rounds that we have been having? So some of the people living are the facilities accessible to them, and so on. Some of these problems, they are beyond what the health sector can solve. So it's a multi-sectoral problem. For instance, if you need to go to the health center to get vaccines and you don't even have maybe money to eat, so vaccination will not be the next thing that you'll be thinking of. If you have the little you have, you are thinking of getting food in your belly rather than taking your child to the vaccination center. So these are some of the problems that are beyond the health sector. So until we all work together, including the other sector, apart from health, we cannot attain the so-called desire that we have in terms of having good vaccination coverage. Thank you.
Thank you. I think that's just drawing on the fact that, you know, we still need to consider the social determinants of health, all the other factors that impact on health, not just the direct health interventions. They all, there's an intersection. They all affect health. Origi Magwaza, I see your hand up. I'll just take one question.
I want to contribute.
Okay.
I wanted to contribute to that.
Okay, go on, please.
Okay. We had the routine immunization intensification in selected LGs, zero-dose LGs, which were the LGs with the highest burden of unimmunized children. And like we have said, our goal is to reach at least 80% coverage with penta vaccines. We are not there yet. So we still have immunity gaps. And it's not uncommon when you have immunity gaps, meaning there's room for the, whether it's a virus or bacteria, depending on which of the vaccines, for there to be outbreaks when we have not reached our herd immunity. So it's not uncommon for that to happen. And that's why part of why we're doing those RI certifications to be able to close those gaps. In 2018, there was this surveillance study that was done. And from what we saw from that result, and that was at the time when the coverages were low, when we had 33% and as low as 3% in Sokoto State at that time. So we so those are those age groups that we saw that they are covered their serum level for antibodies for these vaccines that they collected, because some of them didn't complete their vaccinations. There was a high dropout rate. If they took the first dose, didn't take the second, didn't take the third, or took the first and second. So there was also a high dropout. And that's the age group now in which we're having some of these outbreaks. Because the highest cases are now between those 5 to 14 years of age. And those are people that have been missed previously. So those are people that have those immunity gaps, and we're seeing them, but we are working to address those issues. We're already having an outbreak response to give them the vaccines so that they can we can stem the tide and also protect them further. So I just want to say it's not uncommon. I would not want to say it's just about implementation, but like Dr. Ilesomi said, it's a multi-sectoral and multifactorial. It's a complex issue, as in, so that it's at all levels, and we all have to own up and take responsibility to ensure that every child is vaccinated at the right time, even adult vaccination. Like now we're starting, like with COVID vaccinations, they should have been vaccinated to help us reduce further outbreaks. Thank you.
Thank you, Dr. Adejoke. It seems like you were preempting my question, because I was really going to ask Dr. Elijah Gunshola how we are using data to improve coordination and performance, but you kind of touched on it. So I would just allow Orima Gwaza to ask his question or her question. So you can go ahead and unmute. Are you having, okay, yes, now you can go ahead and unmute. Yeah.
All right, good day. Thank you so much. I really enjoyed the presentation so far. I want to ask a question and then maybe I'll say a little. My question is, to what extent has the primary healthcare system in Nigeria collected data or done a follow-up on cases of immunization, especially in the rural areas? The reason why I ask this question is, more often than not, the highest thing, I'm from Benue State, sorry. The highest thing I've been noticing is they take the drugs to the primary healthcare, the primary healthcare centers located in some of the local governments. They dump the drugs there and they come back. The rest of it, they don't make any follow-ups to know the ratio of either children or the target that is involved in the inoculation or the jabs to be taken, so as to make a report and then know how they can expand their area of coverage. In essence, I'm talking about needs assessment. To what extent has government or the private sector or the health sector, those involved in health sector, done their needs assessment in order to get the figures? Because whether I like it or not, the percentage of children and even adults who have not been taking their jabs or immunization, as the case may be, is still more higher than those who have been taken to this. That's on the one side. Then on the other side, we have been avoiding the media. Don't get me wrong. We believe that I am a media professional, but more often than not, the health people feel that these people are non-professionals, so we don't need to involve them. But information is key. Information is power. Once you give out the right information to the right audience, then you are giving them the knowledge they have to know about these things. That's two. Then three, about stepping down most of these things. They are technically inclined, but then I believe if the primary healthcare system can liaise with non-governmental organizations to step down these programs, at least do a 1-day or 2-day training of most of these NGOs who will help them go to the hinterland to create more awareness on these things and then do follow up, it will make a great deal. And finally, we have our so-called, in quote, opinion leaders, the politicians. When it comes to these things, they go on television, they talk blah, 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 but when it comes to action, they don't want to do the action. Take, for instance, the HPV right now that is going on, that is you are talking about, which I also have a pamphlet here. It will do a great deal if, for instance, the first lady of any state who has a daughter of between age 9 to 14 years, if it is being launched, she will present her daughter to take the first jab. That will go a long way. That is news. But where you don't do such a thing, you only come out and then talk, then your children of that same age range are not there to take such jabs. Believe it or not, you are not encouraging the masses. I rest my case for now.
Thank you. That was a very passionate contribution. We appreciate all your comments. Hope they will all be addressed. You are directing. Can you please tell us what organization you are with?
Okay, I am wearing two caps. One, I am the Senior Information Officer of State Ministry of Health, Benue State. Then I am the focal person for Grass to Amazing Grace Global Foundation, still in Benue State.
Thank you very much. I would just like to note that our moderator from the person who actually started moderating the session, unfortunately, he had network challenges, is actually from the media. I wouldn't hold the brief for the government because I trust that Dr. Dejoke and Dr. Ogunshola will
yes, actually, I've unmuted myself and probably joined the DP. Do I have the floor?
Dr. Ogunshola, you say you're ready to get into it. Okay, I'll yield the floor to you. Go on.
Okay, probably joined late because even in my discussion while addressing the issue of HPV, I said we are already involving the media. None of us working at the PAC or the health sector would downplay the role of media. In fact, I'm sure Dr. Dejoke will still say this. While we're trying to roll out, part of the communication and advocacy strategy was that media practitioners were invited from each state to Abuja, and they were sensitized about this HPV, human papilloma virus. So media are really engaged on the issue of target population. Before we do any campaign, there's what we call micro planning. So we will plan to the micro level in each ward, and we try to extrapolate to get the population. So the issue of whether we do needs assessment, actually we don't call it needs assessment, is micro planning, is done before each round of immunization for if it's campaign, and it is meant to be updated every year by each health facility. So they improve what their target population is going to be using the growth rate of National Population Commission, and they plan according to that. Lastly, on the issue of HPV, if a first lady can lead on that, I told you that of Ogun State is leading by example. She obviously had a jingle running. Of course, she doesn't have any child that is age 9 to 14 because, of course, they are grown. But I told you the Honorable Commissioner for Health came with her personal example. Of course, the daughter is over 25 years, a doctor in the UK, but she took it at the age of 12, when she was in the UK. So for us, if you look at the leadership of our governors during COVID, majority of our governors, traditional rulers were projected, taking it by, leading by example. So we'll try our best to ensure that if we have any top government functionary that have a daughter within that age range, of course, they will lead by example because nobody wants cancer. And the funny part of it is that it won't happen in the, maybe in the next 10 years in them. It's when they are probably in their 40s and their 50s. In fact, so the people that are preventing them would have been long gone. but it will be difficult to reverse. So lastly, I would like you, since you're in Benue State, to reach out to the ES of Benue State. I'm sure she's very progressive. She will be there to assist you to answer some of your questions. Thank you very much.
Thank you, Dr. Gunshola. And I think that addresses it. I don't think, well, but I think I'd like to say that maybe there's room to engage the media more, because somehow this almost always happens, where the media is complaining of not being engaged enough. So maybe we need to pull them in more to find out how, what they think is lacking and how we can improve on this partnership with the media. But I think we'll try to take 2 more, but let's see about Temitope Obayendo. Can we take that? We are supposed to end this conversation at 4:30. Thank you so much. It's been a very engaging and robust conversation. We will take Temitope and then we'll see how we're doing for time. You can unmute now. Please introduce yourself. Let's know what organization you represent, your position, and then ask your question briefly. Thank you.
Good afternoon, everyone.
Good afternoon.
Online editor, Farmer News, Lagos, Nigeria. Yeah, the issue of, like I tried to comment in the chat box, it's fine that we are expanding vaccine coverage, but the issue of uptake is a serious one. That if this discussion will be dedicated to that, I think it's worth it. Because as a journalist, I see even people coming to me to tell me I shouldn't allow my daughter to take this HPV vaccine. And this morning, that was one of the voice notes that my elder sister sent me a voice note. I thought it was a serious issue. All of a sudden, I opened it, lo and behold, it was somebody spreading fake news that there is this vaccine coming up by 11th of this month in Lagos, Nigeria. Nobody should take it. I said, what is all this? So I don't know. Yes, I know a lot of things have been said. We should tell people in authority to bring out their daughters. But how can we effectively convince community people that this vaccine is safe and sure for them? That is my concern, and that is my question. Thank you.
Okay, this is not directed at anyone in particular, so who would like to take this?
Okay, I think let me take that. We will continue to engage the media, all our stakeholders. I think particularly even for HPV vaccines, there's dedicated CSO, civil society organization platform that is working to improve advocacy and using those at the community level to be able to educate people about the vaccine and generally vaccines and access to services as a whole. But we'll strengthen that engagement, and we'll do our best to make sure that even as we, from national and at the state level, we get all our people involved. We're actually working with the Nigerian Governors Forum to be able to get them also to be able to launch these vaccines in their various states. And in fact, the first ladies have been joining our technical working groups to also understand and get a better sense and an idea of what their role is in the introduction of these HPV vaccines. And usually we even engage them long before now for other campaigns like for measles, and we also use the traditional leaders. Like I said, we've had all these engagements, but we'll continue to increase the engagements that we have with both the media and the communities. And it's important that we also realize that it's not just about us engaging the mode. You that has heard now, it's also your responsibility. You can also take it and also use what you have heard and this message and knowing and research for yourself also. Ask questions and whatever, and also get people, advocate for us, get people involved so that we can protect our children and we stop the scourge of vaccine preventable diseases in this country. Thank you.
Great, thank you. We just have time for one last question. So Stanley, Jasmine, please be really quick, introduce yourself and just ask your question and we wrap it up. Thank you so much. Thank you to everyone for your participation.
Okay. Good evening, everyone. My name is Stanley Jasmine from Adamawa State. And my question, and maybe I want to solicit that maybe the poor funding at the lower level of PSA activities is affecting immunization activities. I would like to lay an example with the non-polio SI that was conducted last year in November. As vaccination, which includes measles vaccine, yellow fever, MenA, for at least a campaign for more than 10 days. But to date, as we are talking, most of the teams have not been paid, if not all. So I think some of these things are affecting immunization activities. At the lower level, there are some communities that, community leaders, town announcers that were involved, ad hoc staff that were involved in these activities. And since they were not paid in that particular exercise, it has been affecting almost every exercise that is going to be conducted in the lower level. So I think more focus should be made on financing the local level very well. Thank you, and over.
Thank you very much for your comments. Joke, if you just want to quickly respond to that, and then we close. Thank you.
Okay. Thank you for bringing us to our attention. We had not gotten this report, but we would also verify to be sure that actually those that actually worked that paid, that got paid. But we'll follow up to ensure that all this is done. But usually, we even wrote if we have campaigns. The funds are routed through our partners, and I don't think at this point they haven't paid, but we'll follow up and ensure that those issues are cleared. Thank you.
Thank you, everyone. I would just like to weigh in on behalf of NSF that comment and in some support for the government that I'll say the national MPHCDA is definitely spearheading resource mobilization for immunization, which is why we are actually having this conversation with MPHCDA, and NSSF is partnering to support MPHCDA in some states to help provide some financial support to ensure that these gaps are plugged in states where you might have limited funding that may be impacting on immunization coverage. So I'm sure that as you continue to engage them and relay concerns or any feedback, these issues will be addressed. Again, we have come to the end of this session. Thank you everyone for your participation. Thank you for your comments. Thank you for your questions. I'm sorry about we couldn't take your question. I'm sorry. If you drop in the chat box or the Q&A, maybe we can get someone to respond before we close respond in the box, or we can get a response to you afterwards. Do we have any final comments from anyone before I wrap up? Does anyone have any burning from our panelists, any burning comments?
Yeah, thank you, Dr. Amizi.
Thank you, Dr. Amizi. Thank you, Dr. Amizi.
Yeah, thank you once again. I would like to add, Dr. Adejoke mentioned something that I want us to see as a take home. Now, for you to have attended this webinar, you have committed some time. And I also want to inform us that we are more knowledgeable when it comes to vaccination than an average person on the streets. So part of what we need to do is to take the message to others, try to enlighten them, try to tell them the benefits of vaccination so that we can also play our role in reducing vaccine hesitancy. The truth is vaccine hesitancy is real and it's not limited to only Nigeria. Even in some developed countries, vaccine hesitancy is all over. So please, let's try to play our role, and that's getting the message down to the people. Try to educate them. And even if all the journalists in Nigeria, if they are trained, they can't do the work alone. So we all have our roles to play when it comes to reducing the burden of vaccine hesitancy. Thank you.
Thank you for that nice closing remark. Okay, Dr. Gonshala.
Okay, I would also like to add, as to let my voice to Dr. Adedoke, man from Dr. Lesomi, to say that the community structures are also there. We would, while we are working with the media, because not everyone have access to radio or can read newspaper. So we are going to make sure we work while we're taking along the media, we're all going to use the community structure, which is our CDAs, our CDCs, that's Community Development Association, the village health committees, and our traditional rulers, to make sure we mitigate all this myth. It's just very strong with HPV. It's been there. We're able to wither the storm with COVID. In fact, if you know, with COVID, they did this magnetic thing that if you take COVID, the spoon will gum in your hands. We're able to demystify that. So we're not part of, but we are going to ensure that all of us should go to all the areas where we are staying and sensitize our people in the community. Thank you very much.
Thank you. Yinka Shokumbi dropped the question. I'm not sure we can address right now, but I think it's something that is very important and should be carried on beyond this conversation. And it's asking what exactly is the position on Gardasil vaccine that will be deployed for the HPV vaccination campaign. It appears Nigerians are apprehensive about this vaccine, especially with the publication that the manufacturer has a lawsuit hanging on it, on safety. So beyond this conversation, I think this is really something that's important that can potentially lead to vaccine hesitancy and should be addressed, in the general public. Thank you for that comment. It has been noted. It will be addressed. If anyone wants to reply in the chat box, that's fine. But again, we're over time and we're mindful of people's time, and we'll try and keep it to an hour and a half based on feedback from previous sessions. So I would love again to say thank you so much to everyone for participating. Thank you for your questions. Thank you for your comments. Thank you to our panelists for joining. Thank you to Mr. Shola Ogundikwe, who was supposed to moderate, unfortunately had challenges. We appreciate everyone's time. We appreciate your expertise and lending your voice. To everyone who commented, we thank you for your passion, for taking out the time to be here to discuss leadership and coordination for improved immunization programs. I would also just like to say we've definitely touched on a whole lot of themes and issues, but something that's important is that leadership isn't just at the top. Leadership is necessary at every level, and we need to make sure that at every level the capacity for leadership and coordination is there. Also, it has been said that we are all advocates for immunization coverage. So please, let's go out and spread the right message and encourage people to get vaccinated. And let's all be catalysts for change. I would also like to mention there should be a survey popping up sometime soon. So please don't go until you fill that survey. Thank you. A link will pop up sometime soon. Please fill the survey so that we know how we can better, improve this. Thank you so much. The survey is up. Please quickly just take, I'm sure it'll just be like a minute to fill this survey so that we can continue to improve on this and provide or bring valuable conversations your way, things that will make a difference, your actual work. Thank you for your time. And then lastly, please stay tuned. We will have a follow-on session to this conversation. We will be sending emails to you. Please be on the lookout for our next session. This was part 3 of a 4-part series, and we will send more information to your inbox and phone numbers if you provided any. I appreciate your time once again. On behalf of NSSF, do have a lovely, lovely evening. So please fill out our poll before you head on out. And yes, this session was recorded and the recording will be sent to everyone. It will be sent in the follow-up emails that you will receive. Thank you, thank you, thank you. We will just stay here until as many people as possible fill the poll. Please fill the survey. It helps us to improve on the webinars. To our panelists, it's okay for you to exit once you're done. If you're not responding to any questions and you're not, filling the poll, it's okay for you to exit. But we are going to stay on to allow as many people fill this poll as possible. Thank you again, everyone, for your kind words. Thank you for joining. Thank you for the conversation. It is because you are here that we are here. It's because people are interested in these conversations that we are here. Otherwise, it'll be pointless. Remember to go on and be ambassadors for immunization and get as many people vaccinated as possible, especially with the rollout of the HPV vaccine. Make sure eligible girls go out and get their shots. Thank you.